Hello, my name is Theodora, and first of all, I just want to restate my side's proposition, and that is that comprehensive sex education should be mandatory for all public high schools in the United States. So the word comprehensive is very important to our debate. The first negative speaker, Daniel, argued that the U.S. Center for Disease Control and Prevention, the CDC, is proving effective. Therefore, we're wrong for stating that the U.S. Needs to change it. So I do agree with the statistics that he provided. They are accurate. However, the sex education is not proven to be helpful to all teens. Therefore, we're striving. What we're debating for is to improve the comprehensiveness of sex education. So there are nearly 4 in 10 millennials report that sex education they received was not helpful, and according to a survey by the Public Religion Research Institute. In qualitative research conducted by the Planned Parenthood Federation of America (PPFA) and the Human Rights Campaign Foundation, LGBTQ youth report either not having any sex education in their school or having limited sex education that was primarily or exclusively focused on heterosexual relationships between cisgender people and pregnancy prevention within those relationships. So the LGBTQ youth have a limited number of trusted adults they feel comfortable talking with about sexual health. So the research showed that they frequently seek information online or from peers, which we all know that isn't always accurate. So the U.S. Centers for Disease Control and Prevention say that syphilis has more than doubled among gay and bisexual men since the year 2000. In 2014, gay, bisexual, and other men who have sex with men accounted for 83% of primary and secondary syphilis cases were in the United States. The first negative speaker, Daniel, also stated that our second significant claim about how it would be beneficial to have sex ed in all public high schools lacks credibility because this is the information comes from unreliable sources such as blogs or. However, the U.S. Center for Disease Control and Prevention, the CDC, also provides research that proves that sex ed programs are effective. The U.S. Centers for Disease Control and Prevention research shows that well-designed and well-implemented HIV/STD prevention programs can decrease sexual risk behaviors among students, including delaying the first sexual intercourse, reducing the number of sex partners, decreasing the number of times students have unprotected sex, and increasing condom use. And although the U.S. Centers for Disease Control and Prevention have proved effective, and the United States is doing better by reducing the numbers in pregnancies, as the first speaker stated in his speech, however, we should take into consideration, for example, the Netherlands, which are proving to have a much better number than the United States with their effectiveness in sex education. So maybe there's something we can learn from them. For example, in the Netherlands, sex ed is mandatory starting at the age of 4. On average, teens in the Netherlands do not have sex at an early age than those in European countries or in the United States, as PBS states. Researchers found that among 12 to 25-year-olds in the Netherlands say that they wanted and had fun in their first sexual experiences. By comparison, 66% of sexually active American teens surveyed that they wish they had waited longer for their first time. When the teens from Netherlands do have sex, however, a Rutgers WPF study found that 9 out of 10 Dutch adolescents use contraceptives the first time. The World Health Organization data shows that Dutch teens are among the top users of the birth control pill. According to World Bank, the teen pregnancy rate in the Netherlands is one of the lowest in the world and 5 times lower than the U.S. rates of HIV infection and sexually transmitted diseases are also lower. So whatever they're doing differently, it's working out for them. The United Nations Educational, Scientific, and Cultural Organization found that comprehensive sex ed, when taught effectively, allows young people to, and I quote, explore their attitudes and values and to practice the decision-making and other life skills they will need to be able to make informed choices about their sexual lives. So students who have completed the comprehensive sex education in the Netherlands were also found to be more assertive and better communicators, according to an independent health research agency that conducted a study for the Dutch programs. In the Netherlands, they also strive to inform parents on sex education and how they can speak to their children, and this is clearly making a big difference. So those are the points that I wanted to bring up. Thank you.